I'm Kris-Ann McAliley. I'm the lab director at Medical Center Barbour. If you have been notified by your school, workplace, or someone else that you've been in close contact with somebody that had COVID, you really need to be familiar with that facility's COVID policy because it varies depending on what type of facility it is. So ask questions when the school nurse calls you or your coworker and say, how long does my child need to be out? Do they need to get tested? Some places require them to get tested, some places don't. Just need to be sure you're very familiar with their policies. Then you need to determine when you were actually exposed. You should wait. If you are going to get tested, you need to wait at least 5 days after the exposure. If you go and get tested right away, you'll have a false negative. If you have symptoms of COVID, which include fever, chills, body aches, sore throat, congestion, loss of taste and smell, then you could possibly have COVID. So it's important to get tested. Tests are available at most pharmacies, supermarkets. You can get the home tests. Then urgent care and health department and some of the local doctor's offices have tests. There's COVID testing clinic located across the street from the hospital. That's a great option. If you have to go to the emergency room, just remember that you are treated based on the severity of your symptoms and expect a very long wait time because all ERs are very overwhelmed at this time. If you test positive, you should remain isolated for at least 5 days. After that 5 days, if your symptoms are better, the CDC is now recommending that you can resume your normal activities if you wear a mask. If you test negative, you should kind of still use some caution because if the next day, if your symptoms are even worse, it could have been a false negative or you could have tested too soon. So if you're ever negative, get worse, probably need to get retested in a day or two. Lots of different types of COVID tests out there. So I'm going to try to clear up some of that confusion. PCR, which is polymerase chain reaction, is a molecular test. That is the gold standard. The thing about that test is it stays positive. It shows up sooner and it stays positive longer. It takes a little bit longer for the results to come back. The rapid antigen test is not quite as sensitive as the PCR. It's what the home tests are and most of the rapid tests are. It tells you, it detects the antigen for it, the protein that's in the virus instead of the actual DNA. So it doesn't stay positive as long as the molecular methods. There's also some rapid molecular tests, which are kind of in between the two. They are better than the antigens, but they do stay positive longer than the antigens. So you still have to use a little bit of caution with those two. Generally, you don't have to get retested for COVID. Some jobs and schools are requiring a negative test to resume normal activities, but it's very hard to find those tests. But if you have to have one, you need to wait at least 5 days, make sure your symptoms are getting better, and find an antigen test. The molecular test, the PCR or the rapid molecular, will stay positive a lot longer and you will still have a positive result. So it's very important to make sure you're getting the right type of test if you are retested. Here at MCB, we have a COVID testing clinic located across the street from the hospital. They are open Monday through Friday from 8 to 4 and on Saturdays and Sundays from 10 to 2, and that's just during the surge. That may change once our numbers start declining. But we offer the PCR, which is the molecular test. It's a send-out test. Once you have it collected, it usually takes about 24 to 48 hours for the results to come back, and somebody will call you and notify you with the results. Occasionally, we do have rapid tests available over there, but it just depends on our supplies, and that changes daily on their availability. Whatever you decide to do to be tested, just remember that any of the healthcare facilities, whether it's a doctor's office, the hospital, the nursing home, health department, you're required to wear a mask. So make sure you wear a mask when you come to get your test done. And also remember to be kind because everybody is going through this together.